Hey girl, hey, it's your birth bestie Nurserini, and I'm here to go over another module with you. Today we're going to talk about newborn jaundice. It's very common, so I wanted to go over that information with you in a form of a class. So let's dive in. As you can see, our objectives are on the screen. We aren't going to spend too much time on this. If you have questions, let me know in the comments. Let's go. The big question is, what is jaundice? Jaundice is a buildup of excess bilirubin in the blood. We in the medical field call that hyperbilirubinemia, but the result of hyperbilirubinemia is jaundice. So we all have red blood cells, and red blood cells are always turning over. They show up, they do their job, and then they turn over for new ones to come in. And this happens with babies too. However, oftentimes the baby's liver is immature still, so they are not able to process that bilirubin, that byproduct of red blood cells, quickly enough to keep up with the turnover of red blood cells. So they have a buildup of bilirubin in their blood, and that causes jaundice, or the yellowing of the skin. So how do you know if your baby has jaundice? Typically, babies born to mothers who are O positive or O negative, or otherwise Rh negative, will have a blood type and screen, meaning the lab will find out what the baby's blood type is. And then babies will also be tested for the amount of antibodies in the blood. So you're asking me, what does Rh negative blood mean? So moms, if you are A negative, B negative, AB negative, those are Rh negative. So if you are any of those blood types, your baby would be tested for their blood type and whether or not they have antibodies present in their blood. Those antibodies could indicate that they would have an elevated bilirubin level. However, all newborns are at risk for jaundice, so every newborn in the hospital will get tested for jaundice or hyperbilirubinemia, that buildup of bilirubin in the blood, before they leave from the hospital. Most babies will have their bilirubin checked at 24 hours of life, and if that level is high, then the baby will have blood sent to the lab to determine whether or not that initial reading was accurate, or what we call a confirmatory test. So the blood that the baby has sent to the lab initially to check for their blood type, born to those moms, remember, who are O positive or O negative or Rh negative, is sent by way of the baby's cord blood. So that umbilical cord that is snipped at delivery, the doctors will obtain blood from that and send it to the lab. So you don't have to worry about your baby getting stuck initially. The test that all other babies will get before leaving the hospital is called a transcutaneous bilirubin test. And that test is just non-invasive, super simple. And there's a little handheld device that nurses use, and they just press it on the baby's forehead, and it takes an average reading. Now, most people test babies at 24 hours of age. However, nurses can, at their discretion, usually go ahead and test a baby before 24 hours if they feel that the baby looks yellow or jaundice. So it's up to the nurse to say, this baby's glowing. And they may go ahead and do an earlier test on the baby to see how the baby's doing as far as jaundice. So let's talk about some signs and symptoms of jaundice, because babies can be fine in the hospital and go home and become jaundiced, or they can be right on the cusp in the hospital and a doctor so desperately wants to send you and baby home together as a pair that they may say, go ahead and take the baby home, but you need to know what to look for when you're at home in case the baby starts to deteriorate. So some signs and symptoms of jaundice, the most obvious ones would be yellowing of the whites of the eyes, yellowing of the skin, and jaundice usually gets worse when it's working its way down the body. The baby can become lethargic, meaning super duper sleepy and just hard to arouse. The baby can have high-pitched shrill cries. The baby can have some back arching and neck arching, and then kernicterus, which is very, very severe jaundice that affects the brain. So there are several risk factors to consider when we're thinking about babies who have the potential to become jaundiced. One of the major risk factors would be a premature baby, a baby that is born prior to 37 weeks gestation, a baby who may have an infection like sepsis, blood incompatibility between mom and baby, extreme bruising. And bruising for a newborn who is termed can happen when there is a vacuum delivery. And we do talk more about vacuum deliveries in my paid course. So if you want to know more about it, definitely hit me up and I can tell you how to access that. Surprisingly or not surprising, breastfeeding can also be a risk factor for jaundice. And I remember I had a friend who had a baby years ago, and she said, my doctor said I had to supplement because I wasn't making enough milk, and so therefore my baby was getting jaundice. However, you don't always have to supplement with formula, but there is a reason that the doctors prefer formula. And there are other issues that are listed here that could be a risk factor for having jaundice. So the most common forms of treatment would be phototherapy, those blue lights that you always see. Lots of babies have blue light therapy. And then also feeding, increasing feeds, supplementing the feeds with formula, or supplementing your breast milk with donor breast milk or pumping to make sure that you have a measurable amount of milk to get out so that you can feed your baby. But basically the way that we treat jaundice is by excreting bilirubin through urine and stool. So how do we get the babies to pee and poo? By feeding them. So that's why the doctors typically want you to supplement, because they want a nice firm measurable amount so that they can see how much the baby is getting in and therefore anticipate how much the baby will be getting out. So if you're breastfeeding and you are having inadequate milk transfer, meaning the baby is maybe not latching well or they're not able to get a good amount of milk from the breast, the doctors may want you to supplement for that reason. The exchange transfusion and IVIG are rare. I've seen them happen, but they are rare. The usual first line treatments for jaundice are phototherapy and increasing oral intake. And for that reason, prevention is going to be those feedings, making sure that you are putting baby to breast if you're breastfeeding every 2 to 3 hours, keeping them on the breast for at least 10 to 15 minutes initially. And then if you are formula feeding, then you want to make sure the baby's getting 1 to 2 ounces of formula every 3 to 4 hours. But you want to get in some formula or some breast milk so that you can excrete it out through stool and urine. And that's going to be key. So I hope this was helpful. I know it was really quick, but this was just a super short blast of information for you about jaundice, something that is so common. It happens with 50 to 80% of newborns and even more so in preemies. So definitely let me know if you have any questions, comments, or concerns. Do you know someone whose baby had jaundice? Did your first or second baby have jaundice? Have you been talked to about jaundice because you had it as a child? Let us know in the comments. Like, comment, share, and follow for more.